Hey guys, so I am going to say something that I'm sure is not a common opinion, and it's probably one that you might not agree with, and it might even contradict some of the messages I've put out on this channel, but it's something I want to make pretty clear as far as my beliefs. And that is that you as a human being, as your own agent, are under no moral obligation to take care of yourself. I think a lot of people have an idea that they need to take care of themselves for their children or because it is the correct or right way to live. And while I will always encourage you to take the best care of yourself that you can, it is a personal decision. It is your body, and you do not, under moral obligation, have to take care of yourself. I'm sure a lot of people do not feel that way. I'm sure a lot of people feel like, that's your only purpose in life is to take care of this one body, this one brain that you have. But I think it can kind of be overwhelming, especially when we're talking about taking care of yourself physically. But I think we have this subtle idea that you're not an ethical person if you're not taking care of yourself, and I personally don't believe that. I think that whatever you do or don't do with your body is your decision. What you should not make those decisions out of, especially considering medical decisions, is out of fear. And this is something that I have dealt with quite a bit, and I think a lot of people have anxieties and fears surrounding a lot of different aspects of medicine. Now, another little disclaimer, I'd suppose, is that if you feel like you need to go to the ER, for example, but you do not have insurance and the prospect of it is too financially overwhelming, I understand not going to the ER. Do I think you should go? Yes. I think, you can't put a price on your health, but especially the situation we have in the US, considering our healthcare system, it is very difficult, and I think it's naive to think that everyone can just go to the doctor. I am fortunate enough to have health insurance, and I know based on recent years, everyone should technically have a healthcare provider, but I know a lot of people who don't, and just deal with the penalty come tax season. I know that money is tight, even if you have insurance. Some people can't afford the copay for a doctor visit or for medication, and so I completely understand not taking care of yourself in that way because you don't have a choice, really. If you can't financially afford it, I understand. And this video isn't really targeted towards you, I guess. But if you are able to go to the doctor or go to the dentist or buy that medication or get that test, and you do want to do, logically, you want to take care of yourself in that way, but you are afraid to, this is kind of for you because it's something I've dealt with personally. So for me, my biggest fear probably was always the dentist. I have a true phobia of getting dental work done past cleaning. I can deal with cleaning, but it's so bad that literally I can hear a drill, like not even in a dentist's office, just a drill outside, and it'll make me tense up because it reminds me of some very traumatic dental work I had done as a child. I had to get a couple different root canals. I've had almost every tooth filled with a filling before. I'm absolutely terrified of Novocaine shots, and for a long time in my adult life, even then though I had coverage and it was completely covered, if anything, I had a little bit of a copay, I put it off because I was afraid of it. And some of that regaining of my self-love and self-care was facing that fear and going to the dentist. They have a lot of different options for you. If I have anything other than a cleaning done, I always request laughing gas. They do have sedation dentistry, and of course this is if you can afford it, of course. Otherwise, there are some breathing techniques and anxiety techniques, some of which I've already talked to you about on this channel. But there are ways to get through it, and you know, I think the basis of what I'm trying to get at is that you should never put off treatment because you are afraid. I understand it, believe me, I do. I avoided the dentist for a very long time, and it ended up getting way, way worse than it ever should have. But that is a part of self-love and self-care is doing scary things. Even, you know, facing phobias, because it is what is best for you, if that is what you choose. Another thing I think a lot of people face is fear of the ER, or fear of hospitals in general. It's expensive, there's a long wait, and a lot of people, I think, have the fear that what I am experiencing is not worth the ER visit. And sometimes it is, you know, if you're having chest pain, especially if you're a little bit older, if you're having intense abdominal pain, and this is especially kind of hard for women to figure out sometimes, because I think, I won't get into it, but I think a lot of times people fear that they're going to be written off as just having period cramps when it actually is something like appendicitis. But that's something that, you know, if you feel instinctually that there is something wrong with you, go to the ER. You know, if it's something you think you can bear with, you know, you got a weird feeling in your elbow, then, you know, maybe sit this one out. But my point is, don't stop yourself from going and getting treatment if you feel in your heart that you need to, just because you think it's not important or that you're afraid of the hospital. And, you know, I don't mean to be flippant about phobias, believe me. You know, at the end of the day, sometimes getting over that phobia can be easier than dealing with the consequences down the line for not seeking treatment when you should have. Another thing that I personally have dealt with is not getting tests done because I didn't want to know the answer. For me, I knew, and I kind of discussed this in my weight loss video, but I knew in the back of my mind I had symptoms of either pre-diabetes or type 2 diabetes. I didn't want to know the answer. It was as if I didn't know, then it didn't exist. And I think there are a lot of people who don't get proper screenings and proper testings for something like that, that could, you know, let you know something is off, but it's something that you don't want to deal with. I know a lot of people put off prostate exams and breast exams and stuff like that because they don't want to know the answer, or they're afraid of what they'll hear. And it's way easier to just keep putting it off and putting it off when early detection for a lot of these things is really what makes you survive in the end. And it's scary, but it is something, maybe not a phobia that people have, but I think a very common fear is going and getting the proper tests done, because, you know, if you don't know about it, then you don't have any responsibility over it. And that can sometimes be the most difficult part. As long as we're talking about medical necessities and self-care, is at-home testing. I think a lot of people, for example, men in their early 20s probably think that their screening for cancer is years away from them and they don't have to worry about it. But, you know, as uncomfortable it might be to talk about it, that's like the target age for you to get testicular cancer. So you should be doing at-home exams, and women, even as young as 18, you should start getting used to doing at-home breast exams, and that is a form of self-care. Is it a bath bomb? Is it relaxing? No, but it is something that is important to you if you care about your health, and that is a very personal decision of yours. And it's something I think a lot of us just don't think about, but it's a part of loving ourselves that I think kind of gets tossed to the side a little bit. Especially when life kind of catches up with you and, you know, I have too much to worry about than, you know, this weird feeling I keep having when I breathe. And, you know, that is a part that I think gets left behind a lot in the discussion of self-care. So I hope this video didn't turn out too preachy. I am obviously not a medical professional, but I do know what it's like to put that part of your life on hold and not get the proper tests. I know what it's like to put off getting dental work because you're afraid. I know what it's like to forget or just postpone doing at-home tests. And that's all very important to whole body wellness and self-love. Hopefully I wasn't rambling any bit in this video. I know I jumped from a couple different topics, but the bare bones of it is that if you decide that one of your goals is to take care of yourself physically, then you need to treat the medical side of things like you would the emotional side of things. I know men in particular tend to put off seeing a doctor for things because they just, you know, I don't know. I think maybe it's because they think not everything's not a big deal and, you know, it'll grow back. And I think women can be kind of scared of going to the doctor for feeling like they're not going to be believed or feeling like they're being hysterical, but that's what they're there for, especially if you yourself are paying for it and it's coming out of your insurance and coming out of your wallet, then, you know, you deserve to have that treatment. You're paying for it. It's you know, something you deserve. And if you live without insurance, take care of yourself the best way you can. Don't self-medicate in negative ways. And if you can, get free screenings or go to a free clinic or something like that when you need to. There are a couple options out there for you. So just be safe, you guys. I love you all. And if you ever need to talk about fear of the dentist or anxiety, depression, as I said earlier, I am not a trained counselor. I am not a medical professional, but I know what it's like. So I am always going to be an open ear for you guys. I love you and I'm proud of all of you, and good night.